Thank you very much to everyone that's joined on to the webinar. This is a really important topic. It's an emotive topic. And Thrive as an organization wants to contribute to this day that is recognized globally, Suicide Prevention Day. And ultimately, that is what this session is about. We're trying to encourage conversation, but we're trying to prevent suicide. And that's really what the ambition of this awareness raising activity is. And we are very glad that you can join us for this conversation. So for those of you that are familiar with this platform, there is the ability to engage, to contribute to the discussion. We do want to do that. We will encourage that in places in the session itself. You can do that through the chat. There's a little chat function within Zoom, and you can also do that through Slido. So we will be having several polls throughout this presentation, and that is your opportunity to interact. And we do want people's perspectives on this issue, because we are trying to change the narrative here. So it's important we understand what the narrative is. We hear people's perspectives. So to introduce myself briefly, I head up the customer success team at Thrive Mental Wellbeing, supporting our customers to get the most out of the Thrive service. And delighted to be joined by Adam today. Adam, do you want to give yourself a quick intro?
Yeah, thanks, Rich. Good morning, everyone. Thank you so much for joining. I'm Adam Huxley. I'm a consultant clinical forensic psychologist and one of the co-founders of Thrive. I'm still a practicing clinician, so this is a topic that's on my mind all the time, not just today. And one of the things we say about today is keep the conversation going. It shouldn't just occur on one day of the year, and that's part of changing the narrative about it. So yeah, really looking forward to today, and thank you so much for contributing and joining.
Thanks, Adam. Very important point in that, yes, these awareness days are great, but this is not a once a year thing. Let's encourage this conversation to continue. So to give you a flavour of what we'll be covering and what you will be participating in, changing the narrative. So we'll unpack that a little bit. We'll try and get some perspectives on what people think that narrative is. We'll explore stigma. And then we do want to make this practical as well. So we'll explore some potential ways that you can approach conversations. We'll gauge some feedback from individuals on what sort of preconceptions they might have about approaching this subject. And it is about prevention ultimately. And at the end, we'll encourage you to give some of your views as to what you've seen work, what you think are good initiatives in relation to this subject. So we'll be about an hour, hopefully finish bang on 12, and recognise that this can be a triggering subject for some individuals. So did want to say, if you feel like you need some time out, whatever you need to do for yourself, then obviously do that to support yourself in your situation. And what we always want to do in these webinars, yes, we represent the organisation that is Thrive Mental Wellbeing, but to recognise there are some great organisations out there that are there for individuals who may need their support. And we always like to top and tail these sessions with some signposted links to various organisations that can help individuals addressing this subject matter that is suicide. So if you want to take a screenshot or whatever it works for you, this might be something for yourself, or it might be someone that you're concerned about. And we will share the slides and the recording post-webinar. You'll get all of that as attendees of this webinar itself. Cool. So there is a theme each year, and as Adam's rightly said, this should be a conversation that continues beyond this day. However, the narrative this year is changing the narrative, and that is about how do we reduce stigma, how do we encourage open conversations, but ultimately, how do we lean into prevention? So we will be unpacking those themes. We'll start with this topic of stigma and see how you feel as an audience, as participants in this webinar, and how we can collectively, I guess, address this issue and prevent and reduce the rates of suicide. So that's what we're here to do. And we'd like you to start off that participation element with engaging with this poll. So QR code on the left-hand side of your screen that you should be able to see. And you can also go to slido.com and put in the hashtag there. But starting things rolling then, how do you feel about this? Do you feel talking about suicide is stigmatized? And we'll wait a couple of minutes to let people engage with the poll itself. So at the moment, yes is the dominant response. Quite a few not sure, which is interesting, and we'll unpack that. Tell you one reflection. So before the webinar today, this morning, I went for a run, and regularly do these webinars, co-host them with one of our clinicians today, Adam. And I was a little bit apprehensive about speaking on the topic because I think it's such an important topic to address. But I think that perhaps highlights where there may be some anxieties around talking about this subject generally. So I think that was an important reflection for me that it's also a privilege to have a platform to communicate with others, but it was a subject that didn't quite come with the same ease, and there's a slight amount of apprehension and pressure almost. Um, so yeah, so ultimately we can see that the lion's share of individuals think that yes, this topic is still stigmatized. Not sure is following yes, closely behind with no. So I think there's a lot more noise, and sometimes you are to some degree living representing the organization that I do. We're speaking about mental health day in, day out. So it's really important that we hear your perspectives and what you feel is the narrative and the conversation around mental health and suicide. But overridingly, we can see that, yes, people do believe that this issue is stigmatized. So following on from that, another poll, what thoughts come to mind when you think about approaching someone potentially that may be feeling suicidal? So no right or wrong answers in this, just what immediately comes to mind when you think about the prospect of approaching someone that may be struggling and that you're concerned about. Great. So just to help them, getting it wrong, that's an interesting one. Being calm, gentle, mindful of what to say. So again, maybe lean into what getting this wrong. I will make it worse. Saying the right thing. So there's definitely some themes there, Adam, in what people are, or some people who have participated in this are thinking. That's kind of concern that by saying something, they want to help, but I might say the wrong thing.
Yeah, for sure. And I think that's in the years that we've been doing this, that's always a consistent theme in the feedback that, people want to support each other, but when you come across a topic like self-harm or suicide, it's really a concern that you might make things worse by saying the wrong thing or just generally feeling anxious about how you should approach it. And we'll talk a little bit more about this later on, that, even starting a conversation or responding to a conversation can be difficult, but the expectation is nobody's expecting you to be an expert. And if you think about the opposite action is to do nothing, right? And that's what we're trying to challenge and change here, that nobody's expecting you to be an expert in this field or organize the problem for the person, but the opposite action of doing nothing is something we want to try and get away from. So that's absolutely, and I mean, I still feel the same way about it, that, it's a highly emotive, complex, risky topic to discuss with someone. And of course, you're cautious about not making things worse. So yeah.
Yeah, thank you, Adam. So yeah, I think that the lion's share of responses, and thank you everyone for engaging in these polls, are that concern of getting something wrong, with an undertone of, yeah, we want to help, but want to say the right things. So thank you for engaging in that and for the comments in the chat. So obviously this is an emotive issue. There's an individual behind all of these stats. But I think it's also important to sort of emphasize the scale of the challenge. So globally, we know that suicide claims nearly 750,000 lives each year. And whilst doing this sort of research and preparation for this session, that second bullet point really got me, that suicide, the third leading cause of death amongst 15 to 29-year-olds. So quite sobering, but real life situations that we're dealing with. And great that this is a recognized day and there's more of a narrative, and we're seeing comments in the chat around this being a great topic to discuss and to raise awareness on, but really a need to lean into prevention here. And I think globally, just thinking from that global perspective, you can see 38 countries report having a national suicide prevention strategy. So there's a need to continue to lean into this conversation, to continue to do our part, your part in raising awareness, and hopefully we can contribute to that conversation in an effective way today. And again, some individuals relating with the statistics we've put up there in relation to the young people that are impacted by this. So yeah, I thought, again, there's not going to be too many statistics throughout this presentation, because we do want to get to the meat of some practical things that we can do about this. But this is ONS data for England and Wales, and relative to the size of the population, you can see a couple of trends within the graph. So generally, the suicide rates had been on the decline since 1981, so around 20% reduction since 1981. But we can see that rate has actually gone on the increase, and I think 2007 was where it started to increase again. So we know that this is an issue that by and large impacts males more prominently. I think it's around 3 times the rates of suicide within men versus females. So there's obviously a challenge there that we need to address. But you can see that these rates have been on the increase in recent years. So there's plenty of work to do here. Yet we have, at least to my appreciation, more of a narrative around the subject matter of mental health. Yet we have this increasing and concerning trend here, and some comments again in the chat around those rates and how that affects and relates to the different sexes and genders. So one more poll for you, just to try and get into a better understanding for us all collectively. Which age group is at most risk of suicide? Okay, we'll let this run for another 30 seconds or so. So 15 to 29 is sort of the dominant one at the moment. Rather unhelpfully, although it's great because I can see your face, Adam. Our camera view is looking over the actual percentage, so I can't see the percentage of what it is for 15 to 29. But I can see that is currently the sort of the dominant age bracket people are thinking of, followed by 30 to 44 and 45 to 59. So we'll stop things there and we'll move on to the next slide. And in terms of who is actually at most risk, it is actually that group 45 to 59. So that's predominantly middle-aged men within that age group that face the highest rates of suicide and the highest rates attributed to that age group. Without the danger of sort of generalizing, Adam, are there any sort of initial perspectives before we unpack some of the risk factors and some of the things that maybe contribute to that? Are there any general observations from your perspective that mean that men of that age group tend to be most affected by this issue?
Yeah, I wonder what everyone else thinks about some of the figures you've just seen there, and what that tells you about this whole topic. So we also do a session on men's mental health, and we talk about self-harm and suicide within that, and that there is a difference between maybe how men deal with distress and psychological ill health compared to females. Maybe there's also something about accessing treatment and men being less likely to seek support than females. I mean, I think the truth of the matter is, these are themes, but they don't necessarily tell the story of the person. And when we're trying to support somebody in a clinical setting, for example, we look at the person and what their risks and protective factors are. I just introduced protective factor here because that's something that we want you to think about during this conversation. We're going to focus a lot on risk because of the nature of the topic, but when we're trying to think about how to support somebody, we also think of protective things in their life that might prevent somebody from doing something that harms them. But yeah, I mean, you can see that there are probably a number of risk factors associated with the act, and men in particular, I think, might experience certain life events. Women will too, of course, but again, we'll come on to this when we talk a little bit more about some of the risk factors associated with it. But we do see that men are overrepresented, and it could be that it could be their inability to seek support, or their own concerns about reaching out for support because of stigma, and not finding themselves in treatment services. So yeah, it could be those things as well, and we'll unpick some of the other factors as we go along.
Yeah, absolutely. Thank you, Adam. And yeah, just sort of echoing some of the comments you made there. There's a few comments in the chat around this perception of reluctance for men to talk about these issues, putting on a brave face. And thank you, Ella, who's kind of commented. Yeah, the statistics are a mixture of UK and international based statistics, but we'll share all the sources for those and the presentation after the webinar. So let's let that play through. So let's unpack that a little bit. So when we think about risk factors that are associated with suicide, one of the interesting ones to me, Adam, is and feel free to sort of explore this as you feel relevant for the audience, but the psychological factors, so pre-existing mental health conditions. If we think about what we're here to do, hopefully encourage people to get support early on in that journey, it seems very relevant that that's a relevant message to convey is, if you're not feeling great, then addressing that early on, like any health condition, is an important thing to do.
Yeah, I mean, this probably won't come as a surprise to people, but if you have a pre-existing serious psychological difficulty, so if you have a diagnosis of a severe and enduring mental health problem, it does add an additional risk factor. And there are some conditions, for example, borderline personality disorder, a symptom of which might be self-harm, which then obviously puts somebody at risk of ending their life. There are some other issues as well that can contribute to risk. So we often see people who've got dependent use of alcohol or drugs. That's a definite risk factor. And then adverse childhood experiences. So events that have occurred in people's life that has created a trauma, that could be repeated trauma, that they've carried with them throughout their life, and continues to influence the way that they think and feel. Obviously, that's not true for everybody, but these are the things when we talk to people who've had those thoughts, these are the things that come up time and time again as risk factors. So we've put them there here really just to sort of be mindful of it when you're, talking to people, that these are the sorts of things that could contribute. Again, not everybody who misuses alcohol is going to have suicidal thoughts or self-harm, but it is associated as an additional risk factor.
Thank you, Adam. I think also they're just the contextual factors. Obviously, the economic downturn in 2013 was a while ago, but there are other, I guess, a myriad of factors that can sort of lean into this and someone's experience. We know that financial concerns can play a role in increased stress and this subject matter. So yeah, thank you for that. And there's great activity, by the way, in the chat. So obviously a subject that people want to share their opinions and perspectives on. So let's get these up here. Yeah, why don't we talk a little bit about these warning signs? If we think for a bit more of a practical nature, what are some of those things that someone can look out for? What should be a bit of a red flag for individuals? How can we help people sort of be observant, if you like, in that in this context?
Yeah, I mean, this is really, I guess they're sort of potentially early warning signs that somebody isn't coping particularly well with a distressing experience. What we always sort of say is think of things which aren't typical of the person. So perhaps it represents something unusual in a conversation. And again, that's not to suggest that any of these things might lead to that action, but they're an opportunity to try and explore with that person what it means for them. So if you start to hear from somebody that they're experiencing, a degree of hopelessness, that might be a statement such as, I just can't see a future for myself, or I've got no hope that things are going to change positively for me, or they feel powerless or helpless about a circumstance. I'm just looking over the chat, and there's some really good points that you're making about a life event occurring to somebody. So somebody going through a divorce or a redundancy or some other life event may not cope with that experience particularly well, and they may experience a sense of helplessness or hopelessness as a result of something that's come into their life. For other people, it may be a very different way of expressing distress. So some people express anger as a way of showing you that they're distressed about something. So it doesn't always have to be almost like a depressive type symptom. It could be aggression or anger. You might be concerned that somebody's withdrawing from social interaction. So maybe somebody was always coming to social gatherings or playing with a football team, or was always keen to talk to you, but for some reason now that they're not. So there's something different in that person's presentation that might be a signal that something's not quite right for them at the minute. Or maybe they're using, increased amounts of alcohol, or maybe they've started to use drugs. All those things tell you that something's going on for the person, possibly, and that it's different from what you've usually observed. Or maybe they're just finding it really difficult to fulfill their duties, maybe as a parent, maybe as a partner or a son, brother, daughter, or maybe they're just finding it really difficult to make decisions in their life. Sometimes it's very practical things, like you've noticed there's a real change in somebody's sleeping pattern. Maybe they're awake throughout of the night because they're worried about something or concerned about something. Maybe they're ruminating on something that's distressing them that begins to affect their sleep. Or maybe it's their appetite, maybe they're under eating or overeating. And what you might find in your discussions is a theme that comes out that begins to concern you. So maybe it's about them being a burden and causing distress for other people, or generally just not feeling as though they're looking forward to things, or that they've got a sense that something will improve. So that, again, that feeling of feeling hopeless about their circumstances or worthless as a result of something that's happened in their life. So those are all, cues or triggers or signals for us that something may be going on for somebody, and therefore it's maybe worthy of, a further conversation or a longer conversation. So those are the things that we think of that may be warning signs.
Thank you, Adam. Yeah, and there's a sort of recognition that, key thing, spotting anomalies, as Paul has said, or something different about this individual's behaviour. And loads of comments here. So okay, if we think about some of those potential warning signs, and then as Paul sort of addressed, what can we actually do to intervene, which is perhaps, as we found from the opening poll, or one of the opening polls, quite a challenging prospect for some individuals. So before we do that, perhaps you could, what's the benefit of a comment on the some of these direct and indirect verbal clues, which were kind of alluded to on the previous slide, Adam, in terms of some of the things that people might say.
Yeah, so I mean, of course, there's non-verbal cues that you might look for as well, which is, maybe somebody's presentation, maybe they've started to neglect the way that they look. But these are really things that we're observing in a conversation. So things that we hear from somebody that might be cause for concern for us. So you may hear things, maybe something as explicit as "I want to die," which I think is a pretty explicit, profound statement that might be difficult for you to hear, or worrying or concerning for you, but that's a very clear statement that I think certainly I'd want to sort of explore more with them and try and understand why they've been so direct and said something like that. Or "I can't go on anymore." So it kind of gets progressively a bit more vague, but it's still a signal that somebody might not be coping. "I'd be better off dead." "You'd be better off without me." "Everyone else would be less burdened by me if I wasn't here." So those are all sort of what we might describe as direct verbal signals that they're feeling a particular way. Other times it might be indirect. So again, something that might seem like a bit of a vague statement, but it's still puzzling for you to hear it, particularly if you know the person very, very well, and this isn't typical of them. So you may in your conversation get a statement like, "What's the point of living?" And you might think, well, I wonder why they've said that. That's not typical of them to sort of say those sorts of things. "Soon you won't have to worry about me." "You'd be better off with me." And I think someone in the chats mentioned that sometimes the exact opposite could be a concern. So if you've known somebody to be upset for a long period of time, and maybe you've sort of heard these things for a long time, and then all of a sudden they're presenting very differently, as if things have magically changed for them, sometimes that's a concern, because maybe, as the person in the chat said, they feel as though a weight's been lifted because they've made a plan. But the point we're looking for here is something that's different in their presentation, something that's changed for them, that might be a signal that they're not coping particularly well. So what we call a sort of anonymous description about something, or a change in behavior. Those are the sorts of things that we'd be looking for.
I think quite an important comment in the chat to address as well, which makes this potentially very challenging, is this notion that people might hide these signs, and actually, for all intents and purposes, you observe them to be carrying on as normal, and it's not apparent that there's been a significant change in behavior, and that individual goes on to die by suicide. So again, just I guess from my perspective, not a clinician's perspective, but the importance of just having a conversation and checking in on people, and not assuming that just because there's no behavioral cues or verbal cues that seem out of kilter with that individual's typical approach, that everything's all right. But a good point and a challenging one potentially.
Yeah, I think what we're trying to sort of say here is be curious, and that might seem invasive for somebody, and it might feel uncomfortable for you to just be a bit more curious about why somebody said that or what their intent is. I think someone said in the chat, sometimes they may take the opposite approach, which is to, deny feeling anything or tell you, don't worry about me, everything's fine. So sometimes it's difficult to elicit concern from somebody because they don't want you to know how they feel. So sometimes we look at other sources of information. Maybe we ask somebody that's close to them if they've noticed a change. So we rely on self-report because it's really important. But as somebody said in the chat, sometimes for the reason of stigma or for the reason of not wanting to be a burden to others, they may try and hide that they're feeling a particular way. Sometimes it's, a very real concern about what will happen. So this is related to the stigma and people not wanting to reach out for support. We mentioned we do the men's mental health webinar, and that's a theme that comes up again and again, that men are telling us they don't want to reach out because they're worried about their employment, they're worried about what people might think about them, their own identity as somebody that should be able to cope with distress, and it being a sign of weakness to reach out for support. Those are all things that could potentially stop somebody from telling you, you know what, I'm struggling and I do need some help. So yeah, the curiosity, I think, is what we're trying to sort of really push home with this, which is, you're curious about what's happening for somebody. And you can do that in, some compassionate and interesting ways that won't sort of put the person off from having a conversation with you. And we'll look at that a bit later on.
Thank you, Adam. So this was, again, in sort of preparing for the webinar, found this quite interesting, doing a little bit more research into this staying safe from suicide initiative. And there seemed to be a general acknowledgement, Adam, that, and I guess it's illustrated by the stats here that we see. So every day, 17 people die from suicide in the UK. 5 of those may be in contact with mental health services, but 4 of those 5 are assessed as low or no risk. And my sort of initial reading into that there's an acknowledgement and perhaps drive to move away from more traditional suicide predictive tools and scales to a more holistic approach, recognizing that people can screen, if you like, as low risk, and yet these are the individuals that may then go on to die by suicide. So I don't know if you've got any sort of general comments as to whether there's a bit of a shift in I guess from a clinician's perspective in how we address this, or whether, what your thoughts are there.
Yeah, I mean, there's a big focus, but there's always been a big focus on trying to keep people safe. And a key part of that is recognizing when somebody needs support and then trying to make sure that they have access to the support. And that, is where the difficulty's always been, to be honest, because you know what you know, right? So when somebody presents to A&E, for example, which I would imagine quite a number of people do when they're distressed, you're seeing an accident and an emergency professional, and they've got training in mental health, but of course it's not a specialist service and they're overwhelmed. So the point of contact is really, really the important thing to try and pull people into services. And the challenge and the dynamic there is, how long do they have to wait to be seen? And sometimes, some services have long waiting lists. Sometimes there's a backlog of beds, for example, if you're needing an admission into a psychiatric hospital, sometimes there's a real struggle to get beds. But assessing risk is a challenging clinical task, and sometimes you need the person to reach out to you to be aware of the risk in the first place, right? So it's a good protective factor. Being in contact with services means that they can assess you, they can estimate the risk, and they're able to support you. So one of the things we always say with this webinar and a lot of the other ones is, please do reach out to people for support, because when you're in the process of getting help, it can feel such a relief if you're experiencing distress. And they've got a much better, they being the services, have got a much better chance of supporting you. But we realize and appreciate that that's difficult sometimes for the reasons we've said. It's difficult for somebody to reach out and get support. Maybe they're in a part of the country where services aren't always readily available. So yeah, there's always been a big drive to keep people safe and try and get them into some form of support or treatment as quickly as possible.
Thank you, Adam. So thinking about this then, so practically speaking, and I guess this could happen in a number of ways, you could be concerned about a particular individual, or perhaps you could kind of be a little bit blindsided. Someone could approach you, recognizing that they're struggling, and that that can be a challenging situation for people to engage with and navigate without that fear of saying the wrong thing. So, yeah, I don't know, Adam, if you want to sort of expand on any of these kind of general themes about how we might consider approaching, where we might consider approaching a conversation with an individual, and what we can do and how we can unpack that in sort of layperson's speak and in an empathetic way, I guess.
Yeah, and the emphasis is on you being a layperson or a family member or a work colleague. And as we said at the start, it's really difficult for you to have this information because, maybe you're not a trained mental health care professional and you're really not sure about how to respond to it. But think about what the opposite choice is. It's to do nothing, right? And that's what we're trying to change. We're trying to move from a position of maybe not doing anything to trying to do something. And we realize and appreciate that that's a really difficult task and can feel like quite a burden when somebody tells you something that, might be a statement about their safety. It's really difficult to know how to respond and what to do. And then you might feel the burden in trying to solve it for them, which is really difficult. But there are some things that you can do to just initiate a conversation rather than it just be stopped. And I think you've got, a much better chance to try and help that person resolve it for themselves if there's a conversation going on. So that's all we're trying to sort of suggest you do here. We're not suggesting that you need to manage the problem yourself or have the burden of responsibility to keep the person safe. This can occur in any context, right? So, let's say you're at work and you're chatting with a colleague and there's other people around and you get a statement similar to what we've seen. What we might suggest is the first thing you do is just try and find somewhere that's a bit more private so that you can have a one-to-one conversation with the person. Maybe they're a bit more willing to talk about something if it's in a private space. Again, we appreciate that might be really difficult if you work in a factory, for example. But you can do certain things. You can compassionately listen. That's a phrase that we use, which is just showing them that you're listening to what they're telling you, because it might have been a really big thing for them to open up. And maybe you're the first person that they've chosen to talk about the way that they feel. So just acknowledging that that's been very difficult for them, and that you're listening, and that you do want to try and help them, I think can make a big difference to somebody. It can encourage them to keep a conversation going. So you might start the conversation just by something really simple, which is, well, how have you been feeling over the past couple of weeks? Or I've noticed that you haven't been coming to our football training over the past 3 weeks. What's been happening? What's been going on? So it's just really trying to get a conversation going, rather than you imagine the opposite, right? Which is, I'm having a really difficult week, and you just nod your head and go, okay, great, and you walk off. So it's really just about trying to start a conversation. But we absolutely understand that it's difficult to be the recipient of that information and to hold it and not know what to do with it.
Thanks, Adam. I like that. Compassionately listen. Making this simple in what is also a challenging subject. So developing from that and thinking about, where's a suitable place to have this conversation, but also rightly acknowledging that there might not be an ideal place in that moment. And it may be kind of, you might not be expecting to have that conversation, but perhaps some of these questions here, which are not an exhaustive list of questions that you could be thinking about, but may be helpful in thinking how you could approach that conversation and how that conversation might go. Is there anything here, Adam, that sort of deserves particular emphasis, or yeah?
Yeah, one of the questions that comes up here is, well, should I ask directly? Should I ask the person if they've got any intention to end their life? And I think, it's more about the outcome, or feeling reassured that they're not. And how you go about getting that information is kind of up to you and your relationship with them. I mean, I've certainly been that directive with a question sometimes, because trying to gather information, I felt that I haven't been able to arrive at a decision. So I have been that explicit sometimes and say, do you have any current thoughts about ending your life? So, if you know somebody, you will know the best way to communicate with them, and what they respond to, and what stands the best chance of gathering information to then either reassure you that things are okay, or make you think that you need to ask more questions, and then possibly signpost a person, or make sure that there's some other attempt to get them some support. But I think these are really good questions. They're not invasive, so they're not going to stop a conversation or discourage the other person from opening up. You're inviting the person to tell you a little bit more about the way that they feel. So, just tell me about the time that you felt most desperate. Isn't mentioning suicide or self-harm. It's just inviting the person to think about when they've struggled, or where things have been really bad. And then there's a series of follow-up questions that you could ask. So we want the person to talk to us here, and we want to invite them to feel safe to do so. So that's really the point of these prompts or questions, really. But if it's somebody known to you, you of course know the best way to interact with them and communicate with them.
Yeah, that makes sense. Sort of compassionately listening, knowing that there's not one particular way to communicate. You probably know the best way because you know that individual, but you're then gathering information, and maybe then it's to your example, Adam, you have been more explicit where you thought it was relevant to ask that question, and ultimately signposting and get that individual towards appropriate onward support. So we've kind of leaned into this point here, but maybe it's worth emphasizing and hearing the group's perspectives on this. So if we are worried about an individual, should we ask them if they have thoughts of harming themselves or not? And let's just get those perspectives from those attendees that would like to participate in this poll. And just a quick acknowledgement, there's lots of conversation in the chat, so we'll endeavour to address as many of those points as we can, but we may not get round to every comment and question that's been made, but thank you for that. But we'll try our best to kind of sweep up as much of that discussion as we can as we go along, whilst keeping ourselves to time and respecting that boundary. So yeah, overridingly, yes, we think it is appropriate if we're worried about someone that we would potentially ask them if they've had thoughts of harming themselves or not, as a direct question for the reasons that Adam has kind of described in the previous slide. So thinking about, and I'll just let the bullet points load up. So someone has disclosed that to you as an individual, you've been there, you've been curious, compassionate, listen to them. What practically, Adam, should someone do? And we've got some suggestions and guidance on the bullet points, but is there anything to really emphasize or a key message in this process to share?
Yeah, I mean, this is the tricky things. I'm just looking over the chat, and I think, a theme is not being able to secure support. And unfortunately, that's a problem of healthcare, right? That sometimes it's difficult to get the support that you need. So what we've put up here is just some sort of, again, they're tips. They're not, definitive statements about how you should respond. If it's somebody you know well, you'll know the best way to support them following a disclosure. But if just might be worthwhile thinking about what we've said here. Being calm is really important, isn't it? That when you get given this piece of information, you're kind of holding it, and it's really difficult to know what to do with it then, and you might want to drop it and run away from it yourself because it's overwhelming for you. So even just sort of responding with a sense of calmness can really calm the situation and calm the person. That simple reflection of, I'm so sorry you're feeling this way, but I'm really glad that you told me. It doesn't tell them that it's now your responsibility. You're just letting them know that, you've heard what they've said, you've paid attention to it, and that, you're glad that you heard it because now you're in a position to be able to help. I mean, these are some practical tips which, depending on the situation that you might find yourself in. So, I mean, if you were in a position where maybe you're around a friend's house and you're just about to leave and you've heard something, then, what you might do is just try and ensure their safety. So if they've said, "Oh, I've got a plan to do this tonight, and I've been stockpiling this medication, it's in my bathroom," you might want to try and suggest that they give you the medication or you dispose of it. Or sometimes, it might be the case that you have to request a welfare check from the police or try and support them to attend A&E with you. I realise and appreciate that's difficult. But after the disclosure, if it's safe, then we might try and sort of support them to go and see their GP, to try and gain access to some sort of professional support, whether that's mental health support. People have mentioned crisis teams and not being able to access them. I mean, they are, again, overwhelmed. So sometimes the entry in is quite difficult and you have to be persistent. And you could accompany them if that's the type of relationship you have with the person. You might just say, well, I'll come with you. I know it's difficult. I'll come see your GP with you tomorrow, or let me take you to A&E because I'm really worried about you, or let me try and find a way that I can be there with you when you have this appointment. A lot of support is available remotely now, which is great because that doesn't require you to take the effort to attend, which, guess what, is another barrier if you have to travel for 45 minutes to get help. And then after a disclosure, maybe you feel okay about it, but it's on your mind that they said that. So we always say follow up, which is, could be the next day. We had a conversation, you told me this, I'm just wondering how you're feeling today, or if things are different. So yeah, never kind of leave a conversation there. We always sort of do follow-ups and check-ins and make sure that people are okay.
Thank you, Adam, and for providing that sort of practical context and scenario. And I can see there are a few comments here around various avenues for support, and did want to call out one from Angie in the chat. Angie, I hope you don't mind using your name. If the person has lost someone to suicide, please can you mention our grief and bereavement forum? So for those employees that are familiar with Angie, a part of that organization. So let's get a little flavor from the audience then. So we've talked about some of the ways that can perhaps be direct methods to address an individual who you may be concerned about what that may look like. But what about initiatives that you have seen work well? We've just had a flag there of something that's in place in a particular organization. And this shouldn't be a yes or no poll, thinking about it. So what we'll do is we'll deviate to the chat. So hopefully that if that was rewritten as have you seen good initiatives, then that would work, but it doesn't work in this situation. So feel free to pop anything in the webinar chat. One of the blessings of Slido, sometimes you can get the dynamic wrong. But yeah, if you have any thoughts, but it looks like there is an overwhelming response that is we do see good initiatives out there, and this is certainly part of it. There are various great organizations doing great work to create visibility on this topic. And we talked about some of the services that are out there, including our own, which you can access if you're having challenges in relation to your mental health, and we can support you through to the right appropriate support depending on where you're at. So regular check-in with managers is being mentioned in the chat. I think that's important, just asking how people are, being empathetic, being curious. That can go a long way. So if there's any other thoughts, do post them within the chat. Any initiatives, anything that you've seen work well, that could be in the workplace, it could be outside of the workplace. Yeah, so if your comments around sort of local organizations as well that are there to offer support in challenging times. And the first step is reaching out. So we did want to very quickly run through something. So in our service, if you have access to the full Thrive service, we acknowledge that one of the most challenging things can be reaching out for support. And one of the things that we do that is a sort of unique thing to our organization is we lean into that process. So rather than waiting for the individual necessarily to reach out to us, which they can do, we proactively engage with them if we see that they're struggling. So in the right-hand corner of the screen, you can see a little walkthrough of our app. We do use clinically validated screening assessments. So these, I guess in layperson speak, these similar assessments that you would get, or the same assessments if someone, a GP, for example, was worried about you, is concerned. These are screening for anxiety and depression, respectively. So we can pick up signs that an individual might be struggling. And then when that is the case, we lean into the process. So they've screened, there's an indication that individual might be struggling. They're then signposted towards support, but we will take a step in that process by proactively engaging with those individuals, because we know, like any health condition, the earlier that you can intervene, the better. So for those of you who do have access to our service, you can access through the chat button. And if you'd like to know more about the service, then you can get in touch with us. So again, emphasizing proactive support, leaning into that process, making sure we're signposting people early along, discreet, confidential way that you can do that. And if you have any questions about that or the service, you can contact us through the help@thrive.uk.com email. So again, just to sort of tail the discussion, in case you joined on late, various great organizations out there. You can see them on your screen that can be helping individuals, that you can signpost towards, as well as ourselves. And we're here as a network of support to make sure that more people um, are encouraged rather to seek support when they need it. And we will share with you following the webinar the slides, the recording, the links to the sources. I know that was something that a couple of people were keen to see. So any questions? So we 11:56, we're thereabouts on time. I can see still the chat's quite active. I don't know if there are any ones, Adam, that we haven't addressed that might be handy to pick out. There's lots of sort of supportive conversation going on between individuals, and that's great to see.
Yeah.
Um,
Yeah,
yeah,
no, thanks for participating, everyone. I mean, I can't see all of the comments, but it seems as though you're really supporting one another, which is the whole purpose of this, just to keep a conversation going. If there's any questions you just want to pop in with the time that we've got left, please do. There was one a bit earlier, Graham, thank you, which was if someone expresses suicidal thoughts, should we ask them how they would take their own life? And what we sort of talked about earlier was you'd want to try and establish the risk of means. So I mentioned that the person mentioned that they had stockpiled some medication. So the answer is yes, you would ask them if they had a plan and what the plan was. That would help you decide whether or not you needed to take any action there and then. So yes is the short answer, Graham. You'd want to know if they'd made a plan and what the plan was, and if they had access to means to end their life, because that is going to determine how you respond. If somebody said yes, and I have this day, I'd be thinking, okay, I want to try and do something more immediately. So yes is the answer, Graham. Thank you.
thank you, Adam. We've got a couple of minutes left, so if there's any sort of final lingering questions, then do feel free to pop those in the chat. We'll do our best to answer them. Okay, thank you for sharing these very personal stories as well. Trying to read through that one from Liv, Adam. Not sure if we've got.
I'll try and find.
Yeah, I can read it out if it's helpful.
Yeah, if that's
Yeah.
okay.
If hopefully Liv doesn't mind, posted it in the chat. So
Got it.
kind of an observation, how much we and our medical professionals understand potential underlying triggers, including trauma, which is something you alluded to at the start of the webinar. Yeah, and sort of this acknowledgement that is very important to address.
Yeah. Yeah, I mean, I think all healthcare services will have training in suicide prevention. That's usually illustrated with a suicide prevention policy. So in the hospital I work in, we have a suicide prevention policy. All of the staff are trained in risk management that includes risk to self, so self-injurious behavior or self-harm or thoughts around ending your life. So the training is one thing. Obviously, it's what you do with it then. So yeah, organizations are really pushed to look at that in not just specialist mental health, but A&E, GP practices, and other healthcare organizations.
Thank you, Adam. Yeah, so I think again, thank you for all your questions and comments. If we didn't get to address them, or apologize, but hopefully this has been an informative session, something that we can collectively continue the conversation in our respective workplaces, wherever that may be, in amongst our friends, family, colleagues. So yeah, thank you for the kind comments. We are doing quite a few webinars now. We've increased the amount of webinars that we've done on various different thematic topics. So keep posted of our webinar page, and you can sign up to those sessions on there. And we will be sharing the recording and the presentation with you afterwards. So thank you for your time. Have a good day. Thank you, Adam.
Yeah. No,
You're
you're welcome. And look, there's been a lot of chat, which is great. If you're struggling, please do use the service. If there's one thing we want to leave you with, it's please do seek support, or support someone else to seek support. Help is there if you need it. So please do reach out if you're struggling.
Thank you, Adam. All right, guys, have a good day, and hopefully see some of you soon.